Welcome back. Let's continue here now. The new hospital admissions in Gauteng up to 45% of levels seen at its previous peak. The previous 2 weeks saw new hospitalizations doubling 5 days. Cases since the beginning of the Omicron variant. Cases are said to be doubling every 5 days. The World Health Organization says globally there have been more than 2,700 Omicron cases reported in 59 countries, including 11 African countries that account for about a third of the total cases. Let's now bring in Professor Ramneek Ahluwalia. Good afternoon, Prof, and thank you so much for joining us. Now, it's very concerning because we are seeing these high numbers of hospital admissions in Gauteng specifically lately. Does it in any way mean that the Omicron variant is now very dangerous, or we're seeing that it's actually changed in terms of its severity than what was originally speculated?
Thank you, Nati. Well, Nati, definitely one thing is for sure that we have to take every variant of COVID seriously. And there is no doubt about it. It's still the coronavirus, it's still COVID, and it's mutating. And we've seen a large number of mutations on this variant called Omicron. But there are certain positive things that we also need to consider what's happening around us. As much as we are seeing we've seen about 45% of the previous peak so what we saw in the third wave, the number of admissions in the hospital we've reached now in Gauteng. But still, the number of admissions comparatively to the amount of people who became positive is far, far lower than what we saw in the third wave or the second wave. And which clearly implies that there are three things that are working, at least in a positive way, for us to consider. One, that 70% of South Africans had something called the natural immunity, which means they were either infected in the first wave, second wave, or the third wave, which means 70% of South Africans produce something called the natural immunity. As much it's weaning off, but it's holding its camp a little bit for our immune system. The second thing is more and more South Africans are now getting vaccinated, and which is predominantly what will be the game changer eventually in this whole trajectory of the COVID, not only for this wave, but also in the future waves that are going to follow after the fourth wave as this virus mutates. Because what will the vaccines are doing is they're jumping our immune system to a level that even though this virus enters into our bodies, it tries to escape, but eventually one of our mechanisms of defense system eventually takes over the virus, eventually reducing the hospitalizations and reducing the severity of the infection. And the third one is, which the science will tell, we're not 100% sure, but seems like there's a high possibility that the virus also losing a bit of its virulence. But when we say that bit of a virulence is being reduced, does not mean that this virus is still not going to not infect people and not get them into hospitals. And that is exactly what we are seeing. Predominantly the non-vaccinated people or partially vaccinated people, and even people who are fully vaccinated, which are old with comorbidities, whose immune systems are weaning down eventually because you have taken the vaccine about 4 months, 5 months, then the vaccine immunity starts weaning down, so the virus starts escaping. But what we're still not seeing is what we saw in the second or third wave, which is a very positive sign for South Africa and for the world.
Now, I think you've touched a little bit on it, that the Omicron variant seems to be evading immunity to a certain extent. Talk to us now about the kind of people that are currently being treated in hospital. Are we specifically only talking about those that have not been vaccinated, or those that have also been vaccinated but are being treated for something else other than COVID-19? What's the makeup of those that are currently in our hospitals?
So, Nati, Omicron is a very contagious virus. It's far more contagious than even Delta, which means it spreads very, very quickly between one human to the other. Now, what is happening here is that people who had the vaccines, still, as the vaccine immunity weans off gradually, the virus still enters. The virus doesn't know the other body has a vaccine or not. So it will enter the body. It will start, and how the virus changes its shape is that it tries to escape, which means it becomes invisible for our immune system to recognize that this virus has entered our body. That's how it mutates and changes its shape, starts binding to our cells and starts multiplying, causing a viral load. But eventually, because the people who are vaccinated or had some natural immunity start recognizing this virus and start building an immune system and starts taking over the viral load. And that's why we say the mild to moderate infections are highly possible, even for people who have been vaccinated. But what we are seeing in the hospitals is definitely the non-vaccinated people, because their immune system do not even have the ability of that much power to overcome while the mild and moderate infection is happening in your body, or the mild to moderate viral load is building to happen when the virus is replicating in our body. And that is what we are seeing. But what you also see is people who had early vaccinations, people who are old, people who are still with comorbidities or having certain other conditions which needs hospitalizations with COVID-19 are now coming more into the hospital. But their stays are still shorter. We're not seeing as much severity as we saw in the second or third wave. But every life is precious. Every human being is precious. And that's why certain things that we advocate, remember, this virus is still an airborne disease. It still spreads from one human to the other, which means the systems that we remain from the first wave, the second wave, the masks, the maintenance of distance, the ventilation, they are very effective. Because what will happen is if we start taking guard to it, we will not allow this virus to move from one human to the other, not letting it go to somebody who's more vulnerable to it, and predominantly also not allowing the virus to find a human body, predominantly a non-vaccinated human body or an immunocompromised human body, where it can sit and replicate and still further mutate. So it's going to be a very important social determinant of our behavior, our issues of taking vaccination. We should take vaccination in order for us to decide not only this wave, but the future waves.
Prof, just staying on that issue of Omicron's capability of mutating, and you talk about, just the social behavior in terms of what we need to do as a society and as a global community now that this variant is in 89 countries. Talk to us about the findings, though, from the EU. We know that EU governments have agreed to exercise an option to buy more than 100 million doses of a version of the Omicron variant vaccine, so a prototype of the Omicron specific COVID-19 vaccine. When are we likely to see this being distributed to countries like Africa? I mean, we've seen with the other, vaccines, how long it took for it to reach countries like the African countries. But specifically, I want to know of this intervention, given the fact that, can we really trust people to vaccinate when they should be vaccinating, so that we can, make sure that Omicron does not spread as it's spreading currently?
Nati, you've asked some very relevant questions at this moment. Well, Nati, one thing is what we can't stop as humans is this virus not to mutate, because that's what the virus will continuously do. All the virus is also trying is to survive among humans. It wants to enjoy human body, it's loving human body, it's moving, it's formed a human-to-human transmission, and it will keep trying to locate into a body to start mutating so that it can start escaping and be more able to overpower our human bodies.